Moving on now to our afternoon panel session for day 2, Securing Access and Resiliency for those experiencing homelessness. Hailing from one of our generous sponsors, the City of Austin, is moderator Kimberly Caldwell, Public Information Specialist for the city, Lisa Barton, Executive Director from Keep Austin Fed, Cynthia Hernandez, Community Access and Food Services Manager, Max Moscow, Community Engagement Coordinator from the Other Ones Foundation, and Michelle Miles, Program Manager from Homeless Services Division, also from the City of Austin.
Welcome, everyone. Thanks so much for joining us this afternoon for our panel discussion of securing access and resiliency for those experiencing homelessness. We're excited to be here on the main stage and to share what we've learned about food access for folks who are living unsheltered in Central Texas during the response to COVID-19. We have a packed conversation. You may notice how full our screen is, and a short period of time together. So we're going to dive in. We're going to talk first about what the food system was like prior to COVID-19, what happened when the pandemic hit, what the response was, and then what we hope to see in the future. I'm Kim Caldwell. I'm part of the Eating Apart Together initiative, or EAT. And I'm with the City of Austin, where I focus on communications specifically around the process of ending homelessness. And I'm thrilled to be moderating this session. We have incredible panelists who are with us today, who are all going to they're all going to introduce themselves and their roles related to food and people experiencing homelessness. And I have prepared them to do it in alphabetical order. So please get us started. Lisa.
Hi, I'm Lisa Barton. I am with Keep Austin Fed, and we are a food rescue organization.
Hi, I'm Cynthia Hernandez, Caritas of Austin Community Access and Food Service Manager. Caritas Community Kitchen provides a meal to individuals in homelessness during lunch, Monday through Friday, no questions asked, and the pantry provides food support to Caritas clients.
My name is Max Moscow. I work with the Other Ones Foundation. We were not originally a food access group at all, but we are very much on the ground asking our clients what they need each and every day. And as COVID hit, it rapidly became apparent that food was the need. And so we sort of dove right into that. And that's how I ended up meeting all of the great people on this panel. So one of the COVID-related silver linings is that I got to meet all y'all.
Wonderful. And we are waiting for the internet to allow the esteemed Michelle Miles. Welcome back, Michelle. If you'll please introduce yourself and your role as it relates to people experiencing homelessness and hunger. Michelle?
Nope.
So Michelle, we can see you, but we can't hear you. All right, so I will preview for y'all that Michelle Miles is an incredible leader with a long background in not only homeless services within Austin, Texas, but she's a former board member of Keep Austin Fed, and we're thrilled. I know I personally love working with her, and we're hopeful that we'll be able to hear more from her as our conversation continues. And so let's start by talking about the world as it was prior to COVID-19. And so Lisa, as Keep Austin Fed worked to meet food needs in the world as it was in and around Central Texas, how did your organization interact with homeless serving organizations?
Thanks, Kim. We actually work with lots of organizations throughout Austin, about 60 different organizations. And it is sort of a big misconception that even with my own father, he always says, oh, she feeds the homeless people. And that's not exactly true. Like I said, we work with about 60 different organizations. But of those organizations, about 20% of them have identified as serving the homeless community. So we do reach out to quite a few through our organizations.
And so before the pandemic started, looking to the folks, Max and Michelle, what was your understanding of food insecurity and how people experiencing homelessness accessed food?
Would you like me to go first?
Go right ahead.
So much.
Okay. Prior to COVID-19, the understanding for food access for people experiencing homelessness was that there was enough food in Austin to feed everyone. There was enough food from different feeding organizations, volunteers, mutual aid organizations, groups, individuals giving donations, panhandling. It was believed that there was plenty of food for folks.
And Max, what was your understanding?
I'll just kind of add on to that. I mean, that was definitely my understanding as well. Again, a big part of our service design is really based around outreach and letting the user design the service that's going to end up hopefully helping them. And we did outreach before we launched our first program in 2018. We did outreach for a year to encampments and asked all kinds of questions. And I don't think that food was mentioned one time. It was just not on people's minds as an impending problem in their reality. So again, that all got turned on its head when we got to COVID times. But that was my understanding, is that, you know, for whatever faults may have been apparent in the response system, the food was not one of them.
Yeah. And so, Cynthia, you were already operating at that intersection of homeless services and food. And so what was your understanding of the food needs within our population of folks experiencing homelessness?
Yeah, so as many as 250 people experiencing homelessness would eat in the community kitchen. For some, it was their only meal. The chef and a group of volunteers would prepare a hot, balanced meal Monday through Friday for anyone to come inside and eat in the dining room. The pantries were also open to the clients to self-shop for groceries. So the need was there.
Yeah.
It still is.
Right. And so we're all operating. Oh, Cynthia, did you have more?
No.
Okay, great. So it's 2019, 2020, we're all operating as if we are in control of our own lives. And then COVID-19 hits. Lisa, I'm sure that it's been discussed already, but for the context of this call, can you again, what was happening with the food system broadly as COVID-19 became an unavoidable reality?
Yeah, I think everybody is probably pretty familiar, but there was a huge disruption to our distribution system. So getting food from the farms to the warehouses, to the producers, to the retailers, to the restaurants, et cetera. And then there, on a personal level, there were individuals just hoarding whatever groceries they could find. Mm-hmm. Panic was setting in for people who either were already facing food insecurity or were on the fringe of facing food insecurity. Families are starting to worry about how their kids are going to get fed with school not in session. Catering, which was a huge provider for food that we provided to organizations that serve the homeless community, dried up completely and immediately. So it was just, and restaurants either shuttering their doors temporarily or permanently, which from a food rescue perspective was just sort of feast or famine. A restaurant would shutter its doors and it would be like, we need everything in our freezer and refrigerator cleared out or it's going to get thrown away. And so, finding places that could take that so quickly and then store it was a challenge.
So everything is out of whack within kind of the retail food systems. Charitable food systems are trying to respond. And Max and Cynthia, from where y'all were already serving people experiencing homelessness, what did that look like? How has their reality changed? And your reality as service providers and as folks who were trying to meet needs during, not only food uncertainty, but overall health uncertainty?
I can go, Max. So what I've seen is that it's taken away choices, and it has put limitations on services that we provide. Such as customers receiving a balanced meal, smaller portions, cutting back on food sources, like Lisa had mentioned, dine-in service that provided a safe place to eat in a clean environment with restrooms. In that pantry, clients are unable to self-shop for their groceries, an increase in frequency in the amount of groceries delivered to clients who are homebound. It's done a big impact. It also has impacted the number of volunteers who assist in preparing meals. We are utilizing less help from volunteers since we are not able to have groups congregate. So this affects the complexity of the meals that we serve. We serve meals that are more conducive to a sack lunch rather than a sit-down meal.
Yeah. And so Max, you're all, at the time that all this starts, y'all are not even in the food business. What happened to get you on this panel?
Well, we thought that as this was all happening, one of the big needs that we saw was we were running a day shelter, and we had to start running that at really reduced capacity. And we were talking with other shelters that were starting to run at really reduced capacities. Meanwhile, businesses downtown where people charge their phones, use the restroom, and access other things that we all do in our house, when all those are shutting down at the same time. And so we decided to try sort of a mobile service delivery. Homelessness service traditionally is a congregate style, right? Like, we'll from 1 to 3 p.m. on Mondays, there's this service. Everybody who needs that come from all over town, come gather indoors, get there on public transit, and come all touch the same stuff at the same time, which are just that's all like, don't do this during a pandemic 101.
Right.
So our idea was to roll out something called a mobile hygiene clinic, which is a shower trailer. And we had cell phone charging, we had hygiene supplies, and we were taking this to a different location every day, trying to line up these services. And that's when people started to come up to us, and they were like, they knew they're like, you're the other ones. What do you got? Oh, showers, cool. Don't really care. Do you have any food? And that was when we started to think, maybe we don't have a handle on what people really need right now. And from there, we ended up partnering with Mobile Loaves and Fishes, and they started diverting some of their food to us, and we were distributing food from there. That's also when we started talking. This is right when I met all of you fine people, and we started talking about the EAT program and how to start distributing shelf-stable goods to people so that they would be able to shelter in place, which was another thing that we heard from people. I mean, we all know that throughout this entire time, there's been a whole array of people and their reactions to COVID, for everything from it's a conspiracy and it's not real to I don't know what that is to I'm really scared and I want to shelter in place. And so sheltering in place for people experiencing homelessness is obviously a much more difficult thing. And there was a lot of people saying, like, I want to shelter in place, but I don't feel like I can because I have to come here and I have to go there and I have to get these things. So I think that was kind of where that idea was born from, at least in my experience.
Absolutely. And so, I got to visit one of the mobile showers myself and see, all of the great hygiene piece out there, and also how people were coming there and sometimes foregoing the showers and just getting food. And heard some comments that really stuck with me about the need for that food. And so, Michelle, my esteemed colleague who unfortunately dropped off, so I had to introduce you with all nice things. Would love to hear from you. COVID's hitting, everybody's scrambling. You are on the team of like 2.5, 3 people in the homeless services division. What is starting to happen around food? As all of this is evolving?
So as everything is evolving with the pandemic, because there's a novel virus, we don't know much about it, but we know we need to prevent the spread, right? And there's a need to shelter in place. The shelters are reducing its capacity because of COVID-19. And organizations are closing because a lot of volunteers that work in homeless services are elderly, as well as have underlying health conditions that make them higher risk if they contract COVID-19 for negative health implications. So at Austin Public Health in the Homeless Services Division, we were really thinking of ways that we could mitigate the spread. So we implemented porta potties, hand washing stations throughout the city, protective lodging for people experiencing homelessness who were at high risk for negative health implications. And then also, because everything was closing, food. It was very apparent to us that if things are closing down, then people will not have access to food. So we partnered with across city departments and with community agencies and nonprofit organizations and mutual aid groups to develop the EAT initiative, to pull our best minds together to come up with a collaborative, unique approach to ensuring that people had food where they stayed in encampments, and also allowed for them to shelter in place, to get a lot of the nutrition needs met, water, hygiene items, masks, as well as COVID information, because it was really important to get the word out and dispel any misinformation about COVID-19 so that we can limit the spread of COVID amongst people experiencing homelessness and the general population.
And so this was about the time that I wiggled my way into getting to work with you more, Michelle, and zero regrets. And so we were on all these calls about what the need was. Michelle, can you explain how EAT works? I know we have kind of the sourcing, the packaging, the sending it out into the field, and the consumption. So if you can kind of explain for folks who may not know yet what grocery delivery looks like for people experiencing homelessness in Austin.
So for our program, initially we were going to just do prepared meals, but our community partners let us know right away that there was a need for shelf-stable meals, especially for people who live deep in encampments. So we provide prepared meals as well as shelf-stable meals for people experiencing homelessness. Initially, in the beginning, we got our shelf-stable meals from the Central Texas Food Bank. I think we got that for about 10 weeks or so. We got our prepared meals from Revolution Foods. And then now we're working with Good Works Austin for our prepared meals, and they're a local organization that's designed to keep restaurants open while meeting the needs of the community. And then we also partner with and contract with Cisco Foods for the shelf-stable meals. For the shelf-stable meals. And so the city utilizes a lot of staff to prepare the meals, the bags at the warehouse, which is at the Palmer Event Center. So we prepare meal bags, about 2 weeks of food provisions. 1 week of 2 meals a day provisions for our encampment bags. And then we also have downtown bags, which are smaller, and so that people can, they're more mobile downtown area. And then we provide prepared meals to like the downtown core and other agencies that typically provide feeding in the community. And we've done that to scale up their services and also to reach people that weren't reached before. Now, how we get the meals out to folks is through our community partnerships. And these are individuals, groups, service providers who normally serve people experiencing homelessness, and they distribute the meals throughout the community and deep into encampments. So if there are a lot of people living in encampments, they'll get a bag full of, it'll have food, it's accompanied with water, hygiene items if needed, toilet paper, dog food, cat food if individuals have pets, just whatever someone needs, we could put in the bag and supply to them. It has made a world of difference in people's lives, and also have helped to build relationships with service providers and the people experiencing homelessness.
Thanks. And so, Cynthia, Caritas is one of the recipients of those prepared meals that Michelle talked about, and I would love to hear from you as the pandemic has continued, because we're at 10 months, I believe, past 10 months since the original stay-at-home orders here in Central Texas. What have y'all seen over time? Both with the eat meals and just broadly when it comes to the food needs that y'all are meeting.
Yeah, as we've been talking about, because of COVID, it has changed how everyone in Austin receives a meal. We are limited, obviously, to face-to-face contact, and it has impacted us in many ways, such as by the number of people Caritas feeds daily. Our daily meal distribution has reduced from an average of 275 meals pre-COVID to 150 meals. Restaurants closing and fewer food donations coming in, obtaining reliable food sources has been a crucial response. Therefore, the EAT initiative created by the community of Austin and community partners has been a valuable resource to organizations like us. It has helped with 200 ready-to-eat meals weekly and has supported the community with shelf-stable bags. At the beginning of the pandemic, we served an average of 80 meals daily, but it has gradually gone up to a current average of 150 meals. The rising number of people we feed daily is obviously showing that there's still a need for food in the community.
Yeah. And so, Cynthia, y'all are located downtown, and Max, your tooth has the ability to go out a lot further. And so, y'all, you reach so many more corners of our city than other folks, and y'all were initially a distributor in the shelf-stable meals part of the EAT initiative, and now y'all are in in the food business in another way. And so I'd love for you to talk about how Tooth's journey has gone, y'all's journey since all this started when it comes to meeting folks' need for food.
Sure. Yeah, like you said, we kind of hopped on the EAT initiative and helped distribute there, and then as it gained traction and there was more support for it, we kind of went back to our original park cleanup, back to that plan, and then by sort of a weird series of events that there's not enough time in this panel to talk about, we have now relocated out to what was once known as Camp Rat and is now known as the Esperanza community, which is a state-sanctioned homeless encampment out off Highway 183. And initially, our role there was supposed to be kind of service coordinators. So we were, we just cannot, we're a staff of about 22 people, and there's no way that we can provide services for the 200 folks out there on our own. That was never our intention. Our intention was sort of to function as the cog at the center of a wheel and bring in other providers. So we have community care out there providing like physical health, and then integral care out there doing mental health, and just a variety of other providers. And now one of the new things that we're working on is trying to sort of get a more robust, consistent, and dignified food access program out there. Right now, it's cobbled together. Basically, the Texas Division of Emergency Management puts out MRE rations, which I didn't know what that was until I was out here, so I'll just explain it. But it's basically like emergency rations that are just the exact amount of calories that if you eat it 3 times a day, you don't die. And it's like fruit cups and like crackers, and it's not a viable long-term solution. It's fine if your house was decimated by a hurricane and it's something that you eat for a week maybe or a few days, but can't be a lifestyle choice.
Yeah.
And so right now it's basically that, and then all of these different independent people or faith-based groups just kind of coming through and bringing food whenever they want. And I have been trying to coordinate with all these groups and set up schedules, and it's been very difficult. I think the very first week we got out there in August, I believe it was Tuesday that we received 800 meals from 4 different groups in a 3-hour time span. And naturally, a lot of that was thrown away. And then no more food showed up until I think either like Friday or Saturday. And that was very extreme. And we've definitely curbed that sort of irregularity to a degree, but it's still not where it needs to be. And we are finishing construction. Excuse me. We're finishing construction on a kitchen out there, which we're going to, again, we're trying to be a food access program. Don't know how to do that, really. So we know how to build stuff though. So we're building this kitchen, and then we're basically gonna like sublet it to a group called Free Lunch ATX that everybody who's interested in food access should totally go look up, because they're awesome. And they are going to help run it. And they've been our probably most consistent food access partner. They've been bringing out they've scaled from 1 meal a week to 5 meals a week in the last couple of months. And they are great. They cook amazing food. They are the people who when we first showed up out there, we did a needs assessment, and we learned that the diabetic rate out there is 3 times the diabetic rate of housed population in the United States. So it's over 30% of the folks living out there have diabetes. There's a lot of problems with access to dental care. There's a lot of vegetarian people and vegan people and gluten-free people. And just like when you start piling all that together, you realize that like we need to elevate the food access out there beyond where it's at right now. Because just any 1 or 2 of the things that I just said, nixes fruit cups. They're done. You can't have fruit cups, you know? I don't want to disparage any of what's happening, any of the efforts by any of the people that are out there, because far be it from me to ever turn down food, especially I don't want to turn down food for someone else, you know? Right. But like we have a vision of where it needs to go, and it needs to offer people choice and agency in what they eat, and it needs to reflect the public health needs of that population. So I'm a big fan of the idea of where this is headed, and I'm certain that it will get there soon.
That's exciting, and it brings up something that we forgot to touch on earlier. We have a graphic, but I have not been trained enough to know how to show a graphic, so I'm going to do my best to make visuals with my hands. So when we started to look at this, and Michelle, I'm going to have you speak to this a little more afterwards. What we saw was that when none of us were really focused on food access, people experiencing homelessness were finding food at the intersection of retail food that they bought for themselves, charitable food that was accessed through many of the networks that folks who are at this conference are part of, and what they were able to get through individual donations, whether it's a $5 bill or a granola bar or something handed out of the car. And so as all of those food systems shrunk, suddenly there was a gap. And so Michelle, if you can talk to the process of trying to figure out how to fill that gap with food, and because what Max brought up about choice and meeting people's needs is, I think, is important to talk more about. Maybe Cynthia, you can speak to kind of y'all's menus for a second after that. This isn't part of the approved agenda, but we're going there.
Okay. I like to go into different places. So as all the different food access systems obviously were shrinking because of COVID-19, EAT sought to fill the gap, so to speak, to source food. And the city has the ability to fund sourcing food. Initially, we got the donations from Central Texas Food Bank, which was amazing for the EAT initiative. As we tried to figure out this whole idea of food access for people experiencing homelessness, because it was never really thought of in a very coordinated way before. It didn't have to be, because everyone was able to find food more freely. It was more surplus food available. It was more, restaurants were open. People were rolling down their window or just doing mutual aid work to feed people. A lot of people were passionate to provide food for people experiencing homelessness, but because of the public health orders, that dried up. And so we use the power of the city and the power of collaboration to be able to pool our resources, because what we did have as a city was money and some organizational, ability. But what we didn't have was staff to actually go out to, who was trained and accustomed to working with people experiencing homelessness. By partnering with the community, we were able to fill that gap. We were able to bring food to people where they are, right? We were able to find out, well, what are you actually needing? Or kind of anticipate those needs based on what a person would need to live or survive, or to take care of basic needs like your hygiene. And so by this collaborated effort, leveraging city resources, leveraging community resources, Travis County, constable resources, mutual aid, people, and faith-based organizations, we were able to really address the gaps. And I'm thinking, because at the time when I was told, hey, focus on food access for people experiencing homelessness, and I was like, oh, okay. And the vision that we had to do this, to develop this program, was really just cemented through this community collaboration, by, like I said before, this understanding, this knowledge of the group, to really thoughtfully provide food for people that, if this program didn't exist, if we didn't have this amount of funding, would not have been able to get food, and just the thought about people walking around not getting food, like a basic human right. I mean, a basic thing you need to survive, and it's not to be found. Like, it's wild.
And, we were looking through all of the 211 resources and asking ourselves, how could a person experiencing homelessness access this resource?
I mean, because
yeah,
a lot of the resources are designed in terms of, emergency food service. It's really designed for people who have housing, who have an address, right? It's not tailored for people experiencing homelessness. Not to mention, a lot of the food is frozen meat or things you have to cook and prepare, and people experiencing homelessness don't have access to that, not unsheltered homelessness. So, trying to design a system tailored specifically for people who don't have homes, it's really important.
And so, Cynthia, y'all at Caritas are in the business of both providing food to the folks who you've housed and to folks who are not yet housed. And so, any kind of for the folks in the food world, how do you think differently about those two populations?
Well, our focus is always on homelessness, because that is our vision, and our mission is to help end homelessness in the greater Austin area. So the only difference would be on the food side is, like Michelle was saying, is that we can provide groceries for a family that's already housed. So most of the food is stuff that you have to make and cook. So when we're thinking about what we're giving our clients who are in transition, we need to really think about what's accessible to them, what's easy, ready to eat. And so it may not be healthy food, but it's something. So that's our focus on that.
Thanks. And so, Lisa, as you mentioned earlier, prior to this pandemic, you were working with about 25% groups who were experiencing, who serve those experiencing homelessness. What challenges and opportunities do you see for greater collaboration moving forward when it comes to how we can make sure that we're making nutrition the most powerful support it can be for people who are experiencing homelessness?
Yeah, I think a lot of the opportunities have already been discussed by Max and Michelle through programs, initiatives such as the EAT initiative and the Just Lunch partnership with the Other Ones Foundation. Those are some opportunities that have been just really phenomenal initiatives to address the people who typically face homelessness. And as Cynthia mentioned, there's a lot of resources, or Michelle mentioned, there are a lot of resources for people who are housed. And so seeing some of these resources diverted toward people facing homelessness has been a real opportunity, sort of, to Max's initial comment about a silver lining, if there are any in COVID, is that people are starting to recognize, these other ones that are the kind of behind the scenes. The challenges also, which Max addressed, is the coordination and how do we avoid donation dumping and overloading the few known spaces and the known organizations that serve the homeless population. There's a lot of really good intention out in the community. And, as soon as this pandemic hit, so many people were like, I want to help feed the homeless people. And how can I do that? And so, there are people preparing meals or church organizations preparing meals, and they don't know that many places to take it to. And so everybody takes it to one location, and it may all happen on the same day. And it really does become kind of feast or famine. And there is no mechanism for storing that food for a later date when you have no refrigeration or a home to keep it in. So that's, I think, one of the challenges that we still, it's still a really difficult challenge. It's, in a city as big as Austin, even, it's, how do you coordinate all that? The other challenge is, what happens when the COVID funding runs out? We've managed to find a lot of city and county funding and federal funding to help feed people, but what happens when that funding is no longer available? Or what happens if, the camping ban goes back into place and now the homeless people are less visible, the homeless population is less visible? And then, how do people get food to them then? And how do we coordinate those resources? So I think there are lots of challenges. And, just as in the housed world, we're seeing the challenges of how do you get the food to the people who are in isolation or in quarantine and don't want to get out and go to a food pantry or whatever. How do you home deliver those meals? In the homeless community, it's that much harder because you don't know where these people are. You don't know where their homes are, especially if they get pushed off back into the parks or the woods or wherever they were living before they were able to come out and camp in a more visible location. So
You're making my blood pressure.
I'm making my own go up.
Right. But that's one of the reasons that I think, I'm so excited that this panel is happening is because we want to widen the conversation. And so we have like 3 minutes left. I'm not aware of any questions in the chat. So with our 3 minutes, I'm going to ask everyone, and we'll do alphabetical order again, to share, a quick lesson learned and a hope for the future. And I will say my lesson learned, I'll just go ahead and do this because even though C is after B, I worked in federal nutrition programs for a while in my career, and I was shocked at the lack of resources at the federal level. And so I would like to see resources aligned at the top that look more at how do we meet the needs of folks experiencing homelessness, knowing how challenging it is to find them. And I know there's Homelessness, but what else can we do? So looking at you, Lisa, lesson learned, hope for the future.
Yeah, I'm going to go with the lesson learned is that we can find that funding to help people in need when we're in a pandemic. So it seems like we can also find that funding to help people in need when we're not in a pandemic. And so my hope for the future is that we continue to consider that and we continue to try and meet the basic needs of everybody. And that resilience really does mean coming back better, and that we don't let ourselves slide into this sort of, apathy once COVID is gone.
Thanks, Lisa. Cynthia.
Oh, lessons learned. Okay, I have plenty, but I'll name a few. Because that was 2020 was full of challenges, and I think that we were forced to look at the way we do our service differently. Especially our day-to-day task, we had to be innovative, collaborative, and adapt to changes. It gave us a different view on how we continue to deliver our core services in a clean, safe, and distant mannered environment without any interruptions to our services so that we are able to feed our community. So I think for me, that was a big lesson learned with all those changes, and still continuing to do what we do best. The hope for the future, I feel that amid the struggles, there are signs of hope for the future. I really feel that. And as we all know, that planning and responding to COVID-19 among people experiencing homelessness requires a whole community.
Yeah.
And I say that, I feel that. I do.
Yes. We're going to manifest. So we're almost out of time. Max, real quick, and then we're going to have Michelle bring us home.
Okay. My hope is going to tie into the question in the chat from Kelly, which is how do we coordinate food waste and food access efforts within communities? And I think my hope and what I learned is that as COVID exposed systemic inequities on a level that I don't think a lot of us we knew it was there. This brought it into the light and made it even show more what's going on. And a bunch of people jumped in, and it was kind of like this cluster moment where there was all these people who were like, I want to help. How do we help? And I just hope that everybody hangs in there. And it sucks to be wrong. Sometimes I'm wrong, and people come in and want to help, and then they realize that the way they want to help is more work than it is helping. And I hope that everybody can just hang in there, and we can move forward and find a way that everybody can be a piece of that puzzle that Cynthia was just talking about in the community.
Thank you, Max. And Michelle.
My lesson learned was how fragile the food space for people experiencing homelessness is. And so that was a big lesson, a big aha. And hope for the future is that we could more thoughtfully provide food for people experiencing homelessness, thoughtfully do everything, but food, so this is the topic of today, be more thoughtful, more equitable, and have the funding for it and the need for coordination.
Thank you, Michelle. All right, we are at or past time. I want to say thank you to our incredible panelists for their time today and for all that they've done to serve our Central Texas community during COVID-19. I want to say thank you to the Cook's Nook, and all the conference organizers for putting this together. And I would like to say thank you to all of y'all who joined in this conversation today. austintexas.gov/EAT if you want to learn more about the EAT initiative. Your time is your most valuable and non-renewable resource. Thank you for spending that time with us, and have a fantastic rest of the conference. Thank you.
Thank you.
Thanks, everyone.
This is the awkward part where we sit on here for 3 minutes. My favorite part, the awkward part.
Embrace it.
Okay.
Now we can start talking.
All right.
Max, you started talking too early.
You know what? They needed a little bit for their day. All right, guys. I'm going to click leave. Y'all are wonderful. Thank you so much. Do you want me to schedule a debrief? Anybody care about a debrief?
No.
Or are we done? We're done. Y'all are wonderful. Thank you so much. We'll get out of their way. All right.
Thanks, you guys.
Thank you so much.
Bye, y'all. Thanks.
Bye.